former guests return
You have self-confidence again.
for a checkup with a doctor.
You were in love. You didn't want to lose your marriage.
This is the man that I want to be happy for the rest of my life with.
But will they all check out?
It numbs me out, and it's a quick fix.
It's a quick fix that doesn't last.
Today on Dr. Keith Ablow.
The real things that weigh on people, they're the things they won't look at. I'm a psychiatrist. I've done this work over 15 years. I'm fully committed to holding people's hands while we explore their past. Nobody has a perfect life. I don't have a perfect life. But there are things you can do to make your life better. As a psychiatrist, it's my job to help people confront the past in order to overcome their pain. On this show, I have a rare platform to help my guests start to transform their lives, and I truly hope yours too. Today, we're going to follow up with some of my most memorable guests for a look at how their lives have changed since they visited here. My first guests, Ashley and Jordan, appeared on a show featuring couples whose love lives were nearly non-existent. Ashley's insecurity about her breasts was ruining her sex life. Just that. Take a look.
Jordan and I used to have a great sex life.
She'd be completely naked. I'd, caress her body, and we had the intimate connection.
When I got pregnant, I gained a lot of weight.
Her breasts, got, really big, and she was still happy with them.
When Dylan was born, my breasts began to disappear. It was horrible. I began to look in the mirror, and I was so uncomfortable.
Her breasts, they just lost the weight, and they never pulled up like she thought they would.
I don't feel like a woman. Just seeing the skin hang and sag makes me not feel good, and I feel like I lost some of myself.
Her breasts and her insecurity, it hurts our marriage because, I don't know, we'll fight now about something, but it's really not about what we're fighting about. It's really comes out, it's about her breasts.
It's just really hard for me to want to have sex. I can't have that connection and sexual feeling that I want to feel.
We actually plan sex now, because if we don't, it just doesn't get done.
Jordan hasn't seen me without a shirt on during sex in 2 years because I don't feel sexy.
I tell her, your breasts are fine, honey, don't worry about it, you're beautiful.
Breasts used to be one of my best features. Now I can't stand them. They make me feel terrible about myself.
In order for Ashley to feel confident again and become close with Jordan again, I introduced her to Dr. Engler. He's a world-renowned plastic surgeon. Dr. Engler offered to perform breast augmentation. Take a look.
This problem's been bothering me for such a long time, and now I get this opportunity with a great plastic surgeon, and my dream is coming true. I'm just really nervous, and I can't wait to see my end result.
Please welcome Jordan, and let's see Ashley. Come on out, Ashley. Well, welcome back. Okay, I remember when you were on the show, and I said a lot of psychiatrists would say, no, you don't need breast surgery, you just need more confidence. But I said, look, I'm not like that. I believe sometimes you can have a feeling about part of your body that can be surgically corrected. What was your experience with this surgery?
It gave me a lot more confidence, and mine and Jordan's sex life is back to where it should be.
It's back to where it should be.
Yeah, definitely it is. Now she's actually naked. She's so happy with her.
Well, that helps.
Now that,
yeah.
I used to,
you used to keep your shirt on at all times.
Yeah, now I rip it off.
Well, I didn't know we were going to, necessarily have such a stunning success.
Yeah.
But what you're really saying is that you have self-confidence again.
Yeah.
And do you feel that from her? Does it make her more sexy to you?
Yeah, it does, and now we take showers together all the time. She'll be completely naked. It just really improved our marriage by bringing us just closer together. And I guess you could say it's from her self-confidence.
Yeah.
Related to the breast.
Well, that's the psychological part. Now, the surgical part, we want to introduce now Ashley's plastic surgeon, Dr. Alan Engler, because he's back with us. Welcome, sir. You can stand up, please. Okay. So we meet again. Is this an unusual, because I should ask, because there are going to be a lot of people at home who say, oh, Ablow, you took a shortcut. You should have talked to her about how her marriage could be improved if they accepted her body the way it was. And I felt, look, the marriage seemed to have some problems in terms of questions from the past that we also addressed, but that, look, we also needed to do what she wanted for her body. What's your experience with her?
Right, you know, I think every case is a little bit different, and you scoped this one out exactly perfectly. Ashley was an excellent candidate for the procedure. She had done her research ahead of time, which is an important part of it. She knew what it would do, what it wouldn't do. She came in really knowing about it, and that made her a good candidate emotionally. She certainly was a good candidate physically. She actually needed a more complicated procedure than even just breast implants.
What's that?
She needed breast implants and a lift. So she had to have the tightening of the skin. She has Mentor saline implants in her, which went great. She looks obviously fabulous right now, for which I'm delighted. And so that's what made her really a good candidate. But she was also good. She had done her research ahead of time. That's an important thing for anybody who might be considering it.
Okay, and we'll keep that in mind. And also, I just want to thank you personally.
Pleasure.
Because it's a great favor you did us and for Ashley. Thank you.
And can I say one thing?
Yeah.
I want to thank you for having me on the show and introducing me to this awesome guy. Like, he's changed my life, and I love him. He's awesome.
That's a great, great, great thing to say. Thank you for that.
Thank you.
And I do know that you continue to work. You said that this doesn't make you a new person.
No.
It just makes you a little more confident,
oh, yeah.
and confident enough to work together on some of the continuing issues that any married couple has, right? I just want to make sure I put in that word.
Yeah, we of course we have our issues. I mean, this just helped out our marriage a lot, though. You know, and the fact that she's more confident with her body, and it's improved that part of our lives right there.
Look, not every psychiatrist has a plastic surgeon at his side, but this time it worked out just great. Thank you guys for being
Thanks
here.
a lot, Dr. Keith, for everything.
Up next, a former guest battling an eating disorder shares the new challenges that she's facing. Stay with us.